Thank you so much. Hi, everyone. My name is Celine Mutuyemariya, and my pronouns are she, her. I am an activist, organizer, and a housing justice advocate, and I'm really excited to be with you all today to talk about community and systems level advocacy. Now, before we jump into the presentation, I wanted to start this training off by sharing a bit about my personal background and history. I don't usually like to spend a lot of time talking about myself, but I've also learned that it's important to be open and transparent because that's how you build relationships. And more importantly, that's how you build trust with people. So before I go any further, I just want to make sure, can everyone hear me okay? Okay, cool. Just let me know if any issues come up with sound. So yeah, whenever I meet new people, I always start by telling them that the work I'm doing now is not anything I ever imagined myself doing when I was growing up. And the reason I start off by sharing this is because I think it's just funny how you can have this whole plan for your life and then nothing goes according to plan. And yet somehow you still end up being exactly where you were meant to be. And I think that's just a message that I didn't hear enough growing up, and I still don't really feel as normalized now. So I like to just start off with kind of like that disclaimer about my personal journey. But anyway, so I went to school to study psychology and counseling with the goal of working in therapy. And throughout my time in the healthcare field, first as a counselor and then later as a community health worker, I found a lot of joy in being able to connect people with information and resources to help manage chronic health issues. But I struggled when it came to helping people access and navigate resources to address social determinants of health like housing and financial assistance. One of the frustrations I often shared with my supervisor at the time was, how can I expect someone to prioritize coming to their appointments with me when they're trying to figure out how or where they're going to sleep because their landlord is trying to evict them? I became even more frustrated when I learned about the concept of social determinants of health and read research that explains how one of the most significant predictors of health outcomes is not whether you have the best doctor, but often whether you have stable housing, access to fresh, healthy foods, access to childcare, transportation, all of the things that I'm sure many of you all already know about through your work. As a CHW, one of my responsibilities was connecting people to resources to help address these social determinants of health. And doing that work made me realize that we need more resources in our community, like desperately. I'm sure you all can relate to that. And especially resources that support housing access and stability. So in January of 2020, I worked with other community health workers that I was in relationship with and helped launch a Housing for Health campaign. And our goal was to learn about the landscape of housing organizations working to address housing issues in Louisville, to amplify the experiences our clients were having with housing navigation issues and housing insecurity issues, and most importantly, to work towards solutions. Like I would always go to things and I would hear about the problem, but I would never necessarily hear about how do we approach thinking about solutions. This is around the time that I met George Eklund, who's the advocacy director with the Coalition for the Homeless, and he helped me get introduced to a number of individuals and organizations in our community who are working to address housing issues. And as I learned more, I started to understand the role that elected officials play in making sure, excuse me, our communities are supported and well-resourced. So I made the decision to transition from working in healthcare and actually took a job as a community policy strategist in 2021. Now, after less than a year of working in policy, I transitioned to working in electoral organizing, which is the work that I'm doing now, because over the past few years of learning and experiencing, I've just recognized the importance and the connections between who we vote for, how policies are made, and then how those policies impact our daily lives for better or for worse. So as we get into the presentation, I think you may find some connections between like my personal journey that I just shared and some of the aspects of community and systems level advocacy we'll be talking about. So I'll go ahead and jump right in, and gonna try to have some time towards the end for discussion and questions. But I'll also ask some questions throughout, and I encourage people to drop their responses in the chat or come off mute and share their feedback whenever I go through some of the questions. So we can go to the next slide. So the purpose of today's training is to learn how to use your political power as well as practice self-care and advocacy work. And we're going to use a framework called the social ecological model to demonstrate how different levels of advocacy interact to create community change. And we're actually going to work at this a little bit backwards. So we're going to start with an overview of the social ecological model, and then we're going to move on to talk about using your political power and how that's connected to practicing self-care. Now, thank you. Perfect. So based on the name alone, what do you all think the social ecological model is? Again, you can drop things in the chat or just come off mute. We have time for maybe a couple responses. What do you all think the social ecological model is? Best guess, no wrong answers. Okay, so I see in the chat, Megan says, how you interact with your environment and social systems. Absolutely. Anybody else have any idea? If not, that's okay, we can.
I feel like I remember it being talked about in another meeting I was in recently, but very shortly. But like, it was like individual, and then like our relationships with like our close people, and then like our community and society.
Yes, absolutely. Absolutely right. Thank you, Micah. And Bev in the chat says hierarchy of needs. So we can go on to the next slide. So yes, all those responses accurate.
Sorry,
oh, go ahead. Oh, so I was actually going to say, and feel free to jump back in, but looking at this image based off of what people have already shared, and then looking at this image, what do you all think about this image, or what does this say for you about social ecological model? Pacific, did you have a response? Feel free to jump on. I see in the chat a model that focuses on factors that impact health. Great, absolutely. And if anyone's having trouble with sound and can't get off mute, again, feel free to drop things in the chat. So yes, all of those responses are accurate, and I appreciate you all sharing feedback. So the social ecological model, sometimes people call it the socio-ecological model, but I'll just go with social ecological for now. It was developed by sociologists in the 1970s. And the first time this framework was introduced to me was when I was working in the public health field as a community health worker. Public health professionals often use this model when working on prevention efforts, and they also use this model to develop strategies to promote well-being. So as an emerging organizer, I was reintroduced to this model through conversations with other organizers about strategies that we might use to affect change in our community. And instead of me just kind of like going through each level and explaining kind of in an abstract way, I wanted to take an issue that many of you all are working to address, change, or prevent, and learn about the model through that issue. If we have more time, I might ask you all maybe some other issues we could use as an example, but we can go to the next slide. I felt pretty good about choosing houselessness and housing insecurity as the issue, since it's safe to say that pretty much like all of you, or if not many of you in this room, are focused on doing work that helps to address, change, or prevent houselessness and housing insecurity. So let's think about that issue, right? And then look at it from the lens of the individual level of that model. So let's go to the next slide. What types of strategies or advice have you all heard recommended to people experiencing houselessness or housing insecurity? Like, what do you all hear when, you know, people are getting feedback about how to prevent, address, or change that issue?
You often hear that people just need to get a job and work harder.
Absolutely. What else? What else do people hear?
Hi, I do have a recommendation. Okay, I've been invited to this meeting. It's said because of my advocacy. Now, first of all, I'm homeless. I have been for a couple of years, so I can relate on many levels of this. First of all, I was given a housing voucher a year ago. I have yet to be able to find a place to live, even with this housing voucher through the Housing and Homeless Coalition. the list that you all give out of available units are the same ones that I had, the ones I've gotten now are the same ones I got a year ago. A lot of the people no longer own the property, or, I mean, there's something with everyone, and it's the same list that they give out from public housing. It's not updated. So a recommendation I have is someone needs to maybe go in and verify that these are actual available units. It says available and they're not available, none of them. I've called, like I said, multiple times, the same ones on the same list this many year now, and I'm still homeless. I have a case manager. Now, I'm not sure what their caseload is, but my question is what is my case manager managing? Not my case, because I wouldn't be homeless.
Yeah, Lisa, thank you for sharing that personal experience. I really appreciate you being open with us. And we're going to address a lot of what you brought up. But like you said, individuals are often told, here's a list of housing apartments that we know, or homes for rent that we know. Good luck, figure it out yourself. And Layla mentioned in the chat, many individuals are sometimes told, well, just budget better, right? So let's go to the next slide and look at some of the examples that. So yeah, many people, in my experience, I've often heard, attend a financial education class. People will say, pay your rent, get a better paying job, be a good tenant, be a good employee, don't lose your job. And I always found a lot of issues. And I'm sure many people on this call are like triggered, like, oh my God, what do you mean attend a financial education class? I'm getting paid minimum wage. I know how to stretch a dollar more than anybody else with like $1 million, and I'm still struggling to have my basic needs met. Extremely frustrating. So we'll have some discussion definitely towards the end, but I want to make sure we can get through a lot of the other levels as well. So let's go on to the next slide. So what's a quick example from someone interpersonally? Have you ever gotten feedback or gotten training on how to address housing and houselessness and housing insecurity on an interpersonal level? What are some strategies that folks might use at that level? And if not, I actually have an example. Let's just jump into the examples and we can kind of discuss them. And if other things come up, folks can drop them in the chat. So at the interpersonal level, I've gone to community resource places and said, hey, do you all have financial assistance? My client had surgery. They haven't been able to work. They fell behind on rent this month. And what I'm told is, I'm sorry, we only have a limited amount of resources. Maybe ask a friend or family for help. Well, if people could have done that, they probably would have done that, right? Some other strategies I've heard: work with your neighbors to start a tenants union, organize a rent strike with the people that live in your building, right? The people that you interact with maybe, and your neighbors if you're always around. And I've also heard, negotiate with your landlord, which is a lot of the what I was doing as a CHW, was working with clients and trying to negotiate with their landlords some sort of plan that would avoid that person having to go to eviction court, some sort of transition plan. So there was a lot of that going on. So now let's go on to the next level, which is organizational level. And we can just jump right to the examples. Perfect. All right. So at the organizational level, oftentimes the feedback that I received as a CHW trying to work with people facing houselessness and housing insecurity was, well, find an organization that helps people struggling with housing instability, or ask them to help pay for your rent or dispute an eviction. Maybe even create an organization if one doesn't exist out there. But the barriers I often experienced with that was, an organization might have a great program, but maybe they only have a limited amount of funding. So maybe only 10 people can receive help from that program. Or maybe there's housing vouchers available, but there's limited housing vouchers, right? So we have thousands of people who are on a wait list for a resource that is desperately needed, and that all of those thousands of people actually do qualify for. So sure, I could try to find an organization, and maybe that organization might be able to help a handful of my clients, but there were still a number of people at our healthcare center that unfortunately would not have access to that support. So let's go on now to the next level, community. And we can go to the examples. Thank you so much. Other strategies I've heard at the community level, maybe creating a tenants union group, either with the people of your building, something that's broader across wherever you live. I've heard create and engage in mutual aid networks. And I think that's great, everyday people coming together and pooling their financial resources or any resource they have to offer to support each other. Share resources and information with members of your community. That's what we were trying to do, I think, with the Housing for Health campaign, like all of the resources we knew about and strategies we knew about, we wanted to share them with other people so folks could work on these issues themselves. Start a petition or a campaign, organize a protest or direct action, bring members of your building, neighborhood, community together to advocate or fight against something, for or against something. So all of these strategies are also great. And some of the barriers that come with these is, you have to have time, right? You have to have the capacity to organize a lot of these things. You have to have money to fund a lot of these efforts. So really amazing strategies on their own can come with their own inherent barriers. So definitely pros and cons to a lot of the things we've talked about. What about at the organization? Oh, sorry, the next one will be public policy. Yes, so at the public policy, remember I mentioned that I was starting to get introduced to the concept of like addressing social issues through public policy, really towards like 2019 and 2020. And then that's when I transitioned to working in public policy, because I started to realize like, the way that a lot of the nonprofits in our communities get funding for a lot of the programs, yes, through grant dollars, but much of it also comes from local and state governments as well. And so I thought, well, okay, well, maybe if we can influence legislators and like elected officials to support and fund these organizations, and we can maximize the reach, right? Maybe we'll have more housing vouchers for folks, or maybe we'll have more financial assistance programs that aren't actually just like learn how to manage money that you don't have enough of, but actually like, here is money, here are dollars in your pockets to address the issues. So really got into learning about national, state, and local laws that support housing stability. I started to understand how public dollars can be used to create different funds for things like that. And just started to really explore like how to address those issues at that level, and really was attracted to that. And so I'll say a little bit more about my experience in that public policy realm, but let's go on to the next slide real quick. And so now that we've kind of talked about those different examples, right, at these different levels of our society, of our social ecological model, just what's coming up for folks right now before I continue, or like what's resonating, what's not making sense, what questions do you all have? Just so you know, I'm trained in therapy. I'm good with silences. So I'll wait, because I really want to hear from folks, right? Like, have you all heard some of these things being recommended to you as far as like how you engage with the clients that you're working with? What have you tried? What works? What doesn't work? What's coming up for folks?
That it's really frustrating to try to overcome a systemic issue on the individual level. Like that's a lot of the things that were recommended for clients aren't feasible. And it's because the system itself is broken, and it's really frustrating to have the message be it's pull yourself up by your bootstraps, essentially.
Absolutely, Elizabeth. Thank you for sharing that. Anyone else having thoughts? How many of you have ever heard like, it just doesn't work at all? Like there's no point to work at the individual or interpersonal level. It can only be like at this level. Have you ever heard conversations like that where people are debating about what's the best way to address any social issue? Micah?
Oh no, just that I've like heard that, and I don't know. I think we've had this debate a lot where I work about, yeah, we do have to push at a higher level, but also it does, even if sometimes we can only help one person, like it's still worth helping that one person. Like we can't let people go while we're waiting for the institutions to change that like set our rules and our funding and all of this stuff.
Yeah, thank you for sharing that. So true. People need help right now, right? People are in crisis right now. We got to stop the bleeding right now. So I hear you. and finding that balance between what are the short-term right now Band-Aid solutions that we need. A lot of people call them Band-Aid solutions because ultimately what happens is you might be able to address an issue, like let's say you could prevent one eviction, right, from happening. But then what happens if a person runs into another health problem and maybe they can't work again, right? Working at things individually and incrementally can be hard because ultimately we're not looking at the root cause of what that issue is. And I think a lot of that oftentimes affects how we feel as service providers. We can start to get burnt out because we're like, geez, I'm looking for resources. I'm trying to do my best to help people, but people are still struggling in my community, and it is extremely frustrating. So we're going to talk a little bit more about this whole dynamic, but anything else coming up for folks before I move forward? And we're going to stay on this slide for a little bit. Okay.
Well, in my area, me personally, I have an issue with just the word resource. Because here, to me, okay, resource is putting off on somebody else what you're supposed to be. You're supposed to be a source, not a resource. And that's all we have here are resources. You call a source, and I've done this multiple times in different areas, from domestic violence shelters to housing to churches, and they resource. And I actually was like, okay, where's the nearest? 2 hours from here is this, 2 hours from there is this. And I'm like, okay, tell me about who you're referring me to. And these resources are resourcing you to someone that they don't even know who they're sending you to. And in a domestic violence situation, there's a lot of, good grief, when you leave your home, whether it be man, woman, or a whole family, because to me, gang violence begins at home. And it's like, that could be a very detrimental situation they're sending someone to, and so I am totally against resourcing. I don't even like the word. If you're going to give somebody a number or send them somewhere, you need to know who you're sending them to, and they need to be a source. So in this area, it's pretty much what we got. We're just resourced and resourced and resourced, and nothing changes. And they're still in a bad situation, regardless of which one, that I just named off.
Yeah.
And the churches, that's a whole nother thing. But yeah, it's a whole nother resource, and I'm not even trying to go into that.
Yeah,
but
I appreciate. Go ahead.
It's that's how it is here.
Yeah.
Our public housing here, they want your information. Okay, you're homeless. You have to provide proof of homelessness. Well, how do you have proof of nothing? Until you can provide proof of nothing, they put you on a waiting list to be on their waiting list. Now, I don't even understand why there's a waiting list when there's available housing in public housing. We have them all over the place, empty apartments all over the place. But you got to be on a list to be on a list. Yeah. And it's ridiculous. And to me, it's dangerous. But anyway, that's all I got to say about it.
Thank you, Lisa. Many of the things you said, I've said in my experience, but yes. Sheila, did you have something you wanted to add?
No.
Okay, cool. And so, yes, Lisa, that is like where I live, that the space of frustration, right? Like, there's waiting lists for this. You're bouncing me around between that, and that for, things that I need just for basic needs, right? I've got to go to a food bank on the, east side of town. I've got to go to a healthcare center on the west part of town. I've got to go to try to find housing where my community is on the south side. Like, everything is also very much in silos. And so when I started to reflect on all of those frustrations as a community health worker, I wanted to understand, like, why can't this specific organization solve the problem right now that it's trying to solve? And I realized that there's many well-intentioned people at that organization. There's many well-intentioned people in our community, but they can only work with the resources that they are given, right? The funding that they are given. And so I wanted to better understand that. Because so you see, it's been mentioned in our conversation so far, but when you address issues at the individual level, it's going to affect maybe one person, maybe more. At the interpersonal level, a few more. Organizational level, whoever is a member of that organization. Community, whoever is a part of that community. But when you look at public policy, what happens at the public policy level has the power to impact everyone within the nation, or everyone within that state, or everyone within that locality who the policy applies to, for better or for worse. And so I started to learn about how we got here. How did we get to the point where we're having such issues addressing houselessness and housing insecurity? And I learned about how much of our conditions in the community right now are because of policies that were passed in the past. So everything from FDR's New Deal, if anyone has not ever heard of the New Deal, really think about learning about that, because much of what we see in our housing ecosystem today is a result of policies that were passed and programs that were created in the New Deal. In fact, the New Deal actually created the system of having like home mortgages. Before the New Deal in the 1930s, there was no way to like get a loan to buy a home. It was basically you either had it or you didn't have it to buy a home. So that was a really significant part of our history as a nation that very much influences and explains why things are the way they are today. You can also look at Lyndon B. Johnson's Great Society, or really any public policy that has been passed or even not passed, right? That could have maybe helped to improve things. You can really start to understand a lot of the issues in our community. And that helped me gain a perspective that it wasn't just like what an individual does, right? It's not just like I didn't work hard enough, so I am having this issue. I worked very hard. I did all the things that I was supposed to do. I checked all of the boxes, and yet I am still struggling to meet and access my daily needs. I started to realize that individuals can do whatever they want. You know, they can pick themselves up by the bootstraps, but that does not guarantee a safe and a stable life that has access to all the things that we need. But when we are starting with public policy and saying that as a city, as a state, or as a nation, we know that housing is essential for people. And so now we are going to create policies and fund programs that ensure that everyone has access to safe and stable housing. That is a decision that can be made that would significantly influence like not only the state of our communities, but it would also influence the type of work that we are all tasked to do. It would actually help us achieve the missions that our organizations have, you know, to eradicate houselessness and to, you know, solve all of the big bad things that many of us are impacted by today. And so that was like one thing that I learned, right? But then from there, I was like, okay, well, who creates these policies? Who is responsible for deciding whether or not we create a law that provides, let's say, eviction expungement? You know, evictions often stay on people's records for years and years and years, and then it prevents them from being able to find new housing, right? So someone might be experiencing houselessness simply because they can't find a landlord who will accept them as a tenant because they maybe had an eviction in their past, and that landlord doesn't know why that eviction happened. It could be for a number of reasons, but just because that eviction is on their record, they can't get housing. And so I learned about eviction expungements, like having a law that wipes out any history of having an eviction on your record. And I said, that would be really great. Why doesn't Louisville have that? Why doesn't Kentucky have that? Why doesn't someone create a public policy that would provide that housing stability? So I started to understand like the connections between our legislators and various elected officials. You know, how is policy created? How is it debated? And during my time working in Frankfurt as a policy strategist, I'll be honest with you all, many of our state legislators, at least from my experience, do not prioritize housing issues. When, you know, there was actually a bill filed by Representative Attica Scott for eviction expungements, or it might have been Representative Nima Kulkarni. They are both very great advocates for housing justice. And there was an eviction expungement bill that one of them filed, and it went nowhere. You know, it wasn't heard in the House committee, it wasn't heard. In the Senate committee, on the Senate floor, nothing happened with that bill. And it frustrated me so much because I was like, so many people would benefit in our state from having the ability to wipe evictions off of their record when they're trying to find new housing. There was a number of housing policies that had been filed, but they weren't being pushed along to actually pass and become law because the energy wasn't there. The legislators, in my personal opinion, did not prioritize those issues. And so that got me thinking, like, well, then how do we get legislators who do prioritize these issues? Because it's a simple matter of passing a law. And that law could impact people's lives in a really transformational way, right? And so I'm like, we decide who gets into these seats, right? Like, we actually go vote every year to determine who is going to be the person that represents me in Metro Council, who represents me at the state level in the House and Senate, who's going to be the governor that represents our state, who's the mayor. And so I was like, it's really important for us to pick people to be in these positions who are actually going to prioritize creating policies that have a positive effect on the circumstances and the conditions of our community, right? So, excuse me, let me pause there and just see what's coming up for people as you're hearing some of this. Any reflections or thoughts or questions?
I share your frustration about eviction expungement. I've dealt with the client, one in particular. His eviction it was over 10 years ago. He's worked 2 jobs. He was houseless, trying to do the right thing, wanted to get into a place, had a whole lot of setbacks. Nobody wants to give you a shot when you have that eviction in your record, and it crushes people. They can't get out from under it. And so, like you, I share your very real frustration.
Thank you. Thank you for sharing. Emma, I see what you shared in the chat. I'm trying to read through it, but if you want to hop off mute and maybe put your thoughts out there, please feel free to do so. How many of you all, real quick, when the rent assistance from the federal government came in 2020 because of the COVID pandemic, was that resource, was that helpful to you all? Like, how was it trying to navigate and access that rent assistance? I'll share. Oh, okay, go ahead, Lisa.
Okay, well, here locally, now I'm in Paducah. Like, just an example, Salvation Army. They don't, several of our resources doesn't offer rental assistance unless you've been served an eviction notice. And I don't understand that. Why does it have to get to that point before you can get help? Because if you didn't need the help, you wouldn't have to get to that point. And another issue that we have here is background checks. Like, if you're going to try to rent a place, they run this background check, and Lord forbid if you have a felon, you're going to get denied. Since when? Because you made a mistake, it might have been 20 years ago. It's still going to show up unless if you have the money to get that expunged, you don't need rental assistance because it's expensive to get, any kind of thing, taken off your record.
Mm-hmm.
And here, if you've done anything, and don't even get me in that, because 9 times out of 10, the person didn't even commit that crime. Here you're not innocent until proven guilty. You're guilty until you take a plea because you don't even get the opportunity to prove yourself innocent. But anyway, so a lot of people here have, all this stuff on their background. Since when? Because you've been charged with something, whether you committed it or not, do you not have the same right to have a roof over your head as someone who didn't?
Mm-hmm.
And that's a big problem here.
Yeah.
But anyway, so that, so I don't understand how we can get past, stereotyping who or labeling who deserves a home and who doesn't. I don't understand that. And that hits me where it hurts. Because let me tell you something. I've got a rap sheet that's unbelievable. And most of them, I didn't even commit. But I had to plead guilty or I couldn't get out of jail. And this all leads me into so much. You talk about an umbrella. If we could fix the umbrella, to me, everything that falls underneath it.
Yeah.
I mean, it really upsets me because this is a vicious cycle.
Yeah. And I want to say that there are active efforts. It starts with us being able to have conversations like this, right? Where we can really contextualize, all of the issues that we're talking about and put a name to it, right? And understand not only what's happening right now, but what is the history between what we're seeing right now. I think I see in the chat that Emma, did you want to share what your thoughts were?
Yeah, I think some of what I was talking about here is really just about, I feel like we end up in, like, part of the nature of this cycle is, at least for housing programs, is that there is that limited number of vouchers, and that limited assistance that they can provide. So it means that, first of all, they don't have infinite money, so they can't solve every problem internally.
Yeah.
So then you end up you rely a lot on these referrals and resources, and there are so many different referrals for so many different things, and that, that landscape is changing all the time. And so we can't individually check on this stuff, but then when we have a client like go out and call these things, like, and in meetings like with housing authorities and everything, like when you are explaining the difficulties, like the barriers to all of this, the solution is always, like go to these community resources for it. And there's just that lack of understanding that this stuff, I mean, it's confusing and unreliable for people whose job it is to navigate.
Yes.
Like, never mind for clients, but I also don't know how to rectify that, because then kind of in the last bit where if you've got somebody who can't get over a barrier, there's no resources that can help, this place doesn't have the resources, they're like, nobody can help, then you've got somebody else right behind them on the waiting list who would be able to be housed with that voucher. And so how do you, I don't know, it all comes down to like the scarcity of these like challenging decisions, and there's no one like evil player in this, but it really does come down to like scarcity and underfunding across the board.
Absolutely. And you're right. It's not like there is a person out here whose mission it is to make sure people stay struggling as far as like housing stability issues, but it's a combination, right? We're in an ecosystem. That's really what this ecological model is intended to say. Everything that happens in one part of our society has ramifications and consequences for other parts of our society as well. And that's true with public policy. Let me give you all an example of an experience I had recently. I was advocating in relation to the Louisville Metro City local budget, right? We have $1.3 billion, I think, in revenue, public tax dollars that we as a city are supposed to determine where that money gets allocated to. And every year from April to June, our mayor works with our Metro Council representatives to create and approve a budget that's going to say, okay, we're going to give this much money to our EMS department. We're going to give this much money to police. We're going to give this much money to all the nonprofits who are trying to address social issues. And when I compared some of these departments, right, all the different departments and agencies that receive funding from the government, remember $1.3 billion, the way that money is allocated across the board is so uneven that for some services, like they don't even show up on the bar graph, because some departments are getting millions and millions of dollars, usually the departments who are in charge of incarcerating and punishing people for maybe having issues related to not having resources. But when it comes to how much money is going to go to Neighborhood Place for LIHEAP or another organization for financial security related to evictions, we have a fraction. So we have the money, but ultimately it's a matter of decisions that happen within various levels of government that impact, that result in like the impacts that we see in our community, as far as like whether these things are changing or whether they're basically staying the same because we continue to defund or underfund community resources and organizations while we're funding other initiatives that don't necessarily help, right? So it's a lot, but I think the main point that I wanted to convey in this conversation is that I'm not trying to say that like public policy is the only thing to focus on, because as was mentioned earlier, there are people in crisis right now. And if we can help one person, that's extremely important. And so it's important for us to be able to work at all of these levels. But in my experience, I've seen that we spend a lot of energy looking at like individual solutions. We don't spend as much energy as a society, right? As a society looking at public policy solutions. We have to be working at every layer of this social ecological model in order for us to come up with solutions that will actually have a more of a positive and holistic impact across communities. And it's even like in the way that nonprofits are structured, right? So if you're a 501c3 nonprofit, you are able to address a lot of these like emergency needs, provide direct services, but you're not able to be like to talk about some of these issues in a way that is partisan. And sometimes that you have to be able to name and explicitly say, we as an organization or as a community wanted this eviction expungement law passed, and these are the individuals who did not support, these are the elected officials who did not support this initiative. But when it comes to 501c4s, they have fewer restrictions on being able to be explicit about how the politics connects to the work that they are doing. And yet, the way that our tax system is set up, people are more likely to fund 501c3s because you can get like those funding are like you can get tax refunds from that. And then with 501c4s, the funding offered to those organizations are not taxable. So I know that I'm probably like going a little bit too deep, but the point of this is that all of the work that we're doing every day in our communities is extremely important. And I think that we should also be willing to challenge our organizations or talk to our organizations. Like, we're doing all this great work in the community. We're able to help the people that we can, but what do we need to do to be able to increase our reach or maybe help more people? How should we be advocating? Or maybe even talking to clients, talking to clients about like, do you have a relationship with your Louisville Metro Council member or your state senator or your state representative? And how do we engage them? Because they rely on our votes to stay in office. How do we engage them in conversations about the work that we're trying to do and how they can help support that work by passing policies that would provide more funding and support for our initiatives and efforts? So we can go ahead and go off of the presentation, but we have about 9 minutes or so to just open up the space to see like what people are feeling. I know some of this can be really heavy, but I also want to let people know that there is a lot of work in Louisville. Louisville is one of the most inspiring places because so many people care about the conditions of our community and want to be able to address these issues at every level of the social ecological model. So yeah, I'll go ahead, Ashley, we can stop sharing the screen and then just jump into questions and discussions from here. So I'd love to know too, has anyone ever like attempted to themselves or maybe with a client like navigate some of these things related to how we talk to legislators or elected officials about some of the issues in our community? I'd love to hear people's experiences. I think Joanne earlier said, my city council doesn't even believe we have a problem with homelessness. One actually told me I was making stats up. She also told another advocate he just needs to take the homeless to his home. That is insane to me that an elected official would respond to this issue, to this very real issue, in that way. And I'm sorry that you had to experience that. And you're not alone in feeling frustrated with the way elected officials respond to those issues. So thank you for sharing that. Has anyone else ever had anything similar, or maybe just have questions about some of the content from today?
Well, I think I've got about something to say about everything, don't I?
I love it, Lisa. I appreciate you. Thank you.
I'm actually not saying as much as I could because I want to listen as well, because I want to learn. I was in Louisville here a couple months ago, and again, I go around just to see how people what they do in certain situations, or what they don't do in certain situations. I was in Louisville, and regardless of what happened, anyway, I was on the street there. I don't know my way around. I don't know anyone there. Well, I know a couple people, but I didn't know how to get to them or anything like that. And in between calling the police for help, middle of the night, walking around. Now, mind you, I'm 53 years old, so I'm not a spring chicken. And this is all a new venture for me. And I started out, to me, one of the safest places would be a hospital. I didn't know where to go. I didn't know what to do. And that should be a safe place. Now, mind you, I walk in, somebody kicked back, apparently had nowhere to go, fallen asleep in a chair, was kicked out of the lobby. I actually had went to one, and I was kicked out of a couple different hospitals. I don't know. It all looked the same to me. But regardless, now I'm not suicidal, but I threw this out there to see what kind of response I would get. And I said, I want to kill myself. What can you do to help me? They still kicked me off property. Now, if I'm not mistaken, a hospital is bound to take the appropriate steps for someone that walks in and says, I'm suicidal. Well, apparently, I think there needs to be something done with the knowledge that the people that are, and that's so they know how to respond.
Mm-hmm.
I don't think it's right if someone has nowhere to go that they can't go inside that hospital and just relax for a little bit, get off that street, have a place to cool off or warm up, or have a drink out of a water fountain. That's another thing. This last summer I started, they need to have more of those little porta potties. Because maybe someone just has to get out of a dire situation, and until they can get somewhere, maybe they need to use the bathroom, maybe they're thirsty, maybe they need to wash their hands. And those little stations that have the hand washing, they have water and soap and hand towels. I kind of started advocating that we need more of those around. But I don't see why a person's not able to go into a hospital, which is supposed to be a place to help someone, and because all of this is a sickness. This whole thing is a sickness. So, and actually told the person, which she might have been aware, might have just been, I don't know. Regardless, they need to know what they're doing. They need to, if they're going to, which here locally in one of our apartment buildings, I was speaking to a volunteer. And I said, I hope when you volunteer and you put yourself in that position, the responsibility that still comes along with it, whether you're getting a paycheck or not. You need to know what you're volunteering for. You need to know where your responsibility lies. How much liability do you have in the responsibility that you're taking by being that volunteer? And what they don't know. They don't know. And so to me, whoever puts them in that position, it should be responsible for making sure that they do know. And that happened there in Louisville. It happened here in Paducah. I don't know. Anyway, but that's all I got to say. Well, no, I got a whole lot more to say, but I like to cut it short because I could go on and on.
Well, what really resonated with me
the whole thing with me, and it's a sickness. And We need healing,
Yeah.
public healing.
And the thing you said is like, you just identified a problem and talked about a solution, right? Because you're very close and you understand what could be a solution to address an issue. So that's why it's so important for direct service providers like us, those of us who are directly impacted by these issues as well, to engage with our elected officials and to be actively involved in determining who gets in those seats, because we can propose solutions and we can tell them like, hey, we should probably have some sort of ordinance that says, like, you know, some sort of sanctuary ordinance for people that if they need to access public amenities when they're experiencing houselessness. So I really just want to encourage us to keep having these conversations and work collectively together to figure out how we can do the work that we're doing every day to support our communities, but also think about how we can engage in conversations with elected officials to address the long-term solutions for these issues. Because I think really that's how we get to collective care, right? And I'm not just engaging in self-care so that I can rest a little bit and then go back to some of this really difficult work. But I think some of those approaches can also get to a point where collectively we're all taken care of. And some of our jobs and day-to-day experiences are not so traumatic and difficult. So I just want to thank you all for being here today. And I'm happy to share my contact information with the coalition in case anyone wants to have more conversations about this and keep thinking about how we can be involved and engaged in our communities at all levels. So thank you all.
Thank you, Miss
Thank you for
Celine.
inviting us.
Yeah, and thank you for coming, Miss Lisa. We appreciate it. I also want to thank everyone for coming here today and spending an hour with us and Miss Celine to learn about advocacy. And I also want to thank our sponsor and partners again with Anthem Medicaid. We are also going to have a series installation on August 3rd at noon for the training series of the community table. It will be a case management rockstar panel where it will be a panelist of case managers here locally in Louisville that vary from outreach, respite, shelter case management, and for us to ask questions and find out how they balance advocacy and self-care as a frontline worker or direct service provider. Again, that date is August 3rd. It will be at noon. To register, Melissa, do you mind putting that to register for the next training in the chat? And we can also find that link on our website at louhomeless.org. And we look forward to seeing everyone next time. We also have a survey that Melissa added to the chat. You can add your address to receive a swag bag from our partners at Anthem Medicaid. And that is also gives us feedback to be able to have trainers come and speak to us and make sure that you're getting everything out of this training series that we would like. So thank you all so much. Have a wonderful, wonderful week.
Thanks,
Thank you.
everybody. Thank you, Celine.
Thanks for having me. I really appreciate it.